Hi everyone, my name is Tamika. I go by she and her pronouns, and welcome back to my YouTube channel. Um, Today I just wanted to share a couple of insights around the weight. Sorry, let me put my glasses on, that way I don't feel so blurry. Um, and when I mean the weight, I'm talking about all of these wait times that those of us living with chronic pain, often are struggling with. I was able to get a referral to a pain clinic. Thank God for that. The challenge there is that there is a backlog of about 3 to 4 months, and your symptoms will not subside simply because you're on a wait list. And oftentimes, that in and of itself, the waiting, causes anxiety and causes stress. I'm in a similar predicament too, in terms of waiting for feedback and results for my dog, and to see what course of medical action, if necessary, needs to occur. And I know the wait can drive you up the wall. The wait can really have you ruminating with those anxious thoughts. All of those negative thoughts can be swirling around in your mind. Am I ever going to get a call back? Am I actually going to get a treatment that's going to be useful and helpful to me? How much more am I going to have to suffer with my pain before somebody either takes me seriously or provides me with the treatment and care that I need? And I just want to say about the wait that, as difficult as it is for us to have to be faced with this situation and have to be waiting and waiting and waiting, take that time really to process and understand and get to really know what you're feeling in your body. Particularly as Black women, we're really good at masking, wearing that social mask to make it look like we're strong and we can carry that heavy load. And I think during that period of waiting, that's the time where you can reflect on what is actually happening with your body. When is the pain most intense? What does it feel like when you wake up in the morning versus in the middle of the day? What is it like when you're trying to wind down your day and get ready to go to bed? How does it interfere with your sleep? All of that is going to be good and useful information that you're going to be able to share when you're actually in front of a physician, because you know your body better than any physician and any doctor. So what I'm trying to do, and as I say this and I'm sharing this with you in my journey, is to use this time of waiting, and there's a lot of waiting that it's involved, to get to know what's really happening inside, to get to know what's happening and how it's impacting my mental health, my mental well-being. I also have, underlying mental health challenges as well. Of course, anxiety, that goes without saying for a lot of us with chronic pain, because either we're living with the pain and we just don't see an end to it, or we don't know the source of the pain and why it's happening and what can be done to bring an end to it as well. And oftentimes that means a lot of experimental treatments, different medications with various side effects that negatively impact your day-to-day functioning. I can empathize with that because I've been there. I was on a medication where yes, it was helping with the pain, but at the same time, it was turning me into basically a zombie. I wasn't able to function. And I had to let my healthcare team, my primary care physician, the rheumatologist, like all the people involved in my circle of care and treatment, I had to let them be aware that this isn't working. And just because it's what you prescribe to other people with similar conditions and it does work, that doesn't mean that it's going to work for me, and it was not working. So I really encourage you to take the time during the waiting to get to know what's happening in your body, to be very, very sensitive to what is going on. Be sensitive also to the stresses, the external stresses that could be adding to the underlying chronic pain. For me, it's so important to have physical activity and movement. Otherwise, my pain just skyrockets off the charts. So that means moderate to gentle exercise, which for me is usually in the form of walks. So that might not be your situation. Maybe for you, that's not something that you're able to do Maybe you need to do something else like gentle yoga. Maybe you need to do aquafit. Maybe you need to be in a heated pool, for example. Maybe it's just, even if it's just gentle stretching exercises. It could be a number or a combination of all of those. Of course, you're going to connect with your healthcare team to know what is safe for you to do. But whatever gives you that relief, you should be able to identify those things. Because when you do go and finally get in front of these doctors, you need to be very clear about what is wrong, where it hurts, the intensity of the pain, the different times of day, and some of the remedies that you have been using to try to seek relief. So you really need to know what's going on in your own body. Don't follow the path of ignoring the pain, of ignoring the symptoms. I did that for so many years. And I actually did that in the pursuit of thinking I was going to have this high power, highly successful career. And I was willing to literally sacrifice my own body for a job that today I no longer have. I no longer even have contact with any of those individuals that are related to that type of that job. They did not reach out to me in any kind of supportive way. And for me, when my internal organs were shutting down and I nearly died on March the 2nd of 2019, I wasn't thinking about going back to work and being this highly successful professional. And I didn't find any comfort from anyone in the office because nobody even bothered to even send a card to say get well soon. You really get to see the character of people in the midst of crisis. So don't put yourself as Black women on the back burner. You have to put yourself in a position of advocacy when you need to, but also you have to have the care and self-compassion and the self-love. Know that you are made in the image and likeness of God, and therefore you should be taking care of your body. That means listening to those signs and symptoms, no matter how small or how minor they may be. And when you're living with chronic pain, it's really important not to ignore any of those signs and symptoms because you don't know what it could be leading to. So take the time in the wait. I know the wait is hard. I know the backlog is overwhelming. And I know you're probably sick and tired of hearing from these physicians that they have an enormous backlog and the referral will be 3-4 months or 10 months down the road. And they can't give you a specified time at this point in time because they have so many other patients. And it's a mantra they keep saying over and over and over again. That's all well and good. But in the meantime, turn inward and listen to your body. So as I always say, listen to Black women, amplify our voices. And if you stand with us shoulder to shoulder, then you will listen to our stories. Know that we have stories to tell and our experiences are real. I heard the other day that an acronym for HOPE is hearing other people's experiences. And for us as Black women, we've been historically shut out. So listen to us, know that we are worthy, we are deserving of love, we're deserving of joy. Thank you everyone for listening, and I really do hope you have a blessed day. Goodbye.